Hypertension, often called high blood pressure, is a persistent and abnormal elevation of arterial blood pressure. It's a condition that can go unnoticed for years, earning the nickname silent killer. Hypertension is diagnosed when a person consistently has a systolic blood pressure of 140 mmHg or higher, a diastolic pressure of 90 mmHg or higher, is taking antihypertensive medication, or has been told by a healthcare professional on at least 2 occasions that they have high blood pressure. This condition is incredibly common, affecting nearly half of the adult population, and its prevalence increases with age. Obesity, unhealthy diets, and physical inactivity are major contributors. Hypertension is a leading modifiable risk factor for cardiovascular disease and stroke, making early detection and management crucial for long-term health. In the next scene, we'll explore the underlying causes and risk factors that contribute to this widespread condition. Causes of hypertension are generally divided into 2 categories: essential and secondary. Essential hypertension, which accounts for about 90% of cases, has no identifiable cause but is influenced by genetics, age, obesity, and lifestyle factors like high sodium intake and physical inactivity. Secondary hypertension, making up about 5% of cases, results from underlying medical conditions such as chronic kidney disease, hormonal disorders, or the use of certain medications. Risk factors for hypertension can be fixed, like age, family history, and chronic kidney disease, or modifiable, such as smoking, unhealthy diet, obesity, and lack of exercise. Psychosocial stress and socioeconomic status also play a role. Understanding these factors is key to prevention and management. Next, we'll look at how hypertension develops in the body and why it's so dangerous if left untreated. Hypertension develops when the mechanisms that regulate blood pressure malfunction. The renin-angiotensin-aldosterone system, RAAS, is a major controller, and disturbances here can lead to sustained high blood pressure. Other contributors include abnormal neuronal mechanisms, defects in vascular regulation, and imbalances in substances like nitric oxide and angiotensin II. Over time, high blood pressure damages blood vessels and organs, leading to complications such as heart attack, stroke, kidney failure, and vision loss. Because symptoms are often absent, many people are unaware they have hypertension until serious damage occurs. That's why regular screening and early intervention are vital. In the following scene, we'll discuss how hypertension is diagnosed and the goals of therapy. Diagnosing hypertension involves measuring blood pressure accurately on multiple occasions. The goal of therapy is to reduce the risk of complications like heart attack, stroke, and kidney damage. Most guidelines recommend maintaining blood pressure below 130/80 mmHg, especially for those with diabetes or chronic kidney disease. Treatment begins with lifestyle modifications, such as adopting a healthy diet, reducing salt intake, increasing physical activity, and managing weight. If these changes aren't enough, medications are introduced. The choice of medication depends on the patient's overall health, age, and presence of other conditions. In the next scene, we'll break down the main classes of antihypertensive drugs and how they work. Lifestyle changes alone aren't enough. Several classes of medications are used to control hypertension. Thiazide diuretics help the body eliminate excess sodium and water. Calcium channel blockers relax blood vessels, making it easier for the heart to pump. ACE inhibitors and angiotensin receptor blockers, ARBs, target the RAAS system to lower blood pressure and protect the kidneys, especially in patients with diabetes or chronic kidney disease. Beta blockers are used in specific situations, such as after a heart attack or in heart failure. Each medication has its own benefits, side effects, and monitoring requirements. Sometimes a combination of drugs is necessary to achieve target blood pressure. In our final scene, we'll look at the complications of uncontrolled hypertension and why early management is so important. Controlled hypertension can have devastating consequences. It increases the risk of heart attack, stroke, kidney failure, and damage to the eyes and brain. High blood pressure can cause progressive damage to the heart and blood vessels, leading to heart failure and other life-threatening conditions. The good news is that with early detection, lifestyle changes, and appropriate medication, most people can manage their blood pressure effectively and reduce their risk of complication. Regular monitoring and working closely with healthcare providers are essential steps in maintaining long-term health. Remember, managing hypertension is a lifelong commitment, but it's one that pays off by protecting your heart, brain, and kidneys for years to come.